Coke and Pepsi. Or it could be a whole list of products, Taco Bell, McDonald's, Subway, or a local burger joint. So much of America is defined by competition. What do you want to eat? What do you want to wear? But one area that's not like the others is healthcare, especially for American Indians and Alaska Natives. If you live on a reservation or in a native village, the one choice for healthcare might be the Federal Indian Health Service, or perhaps a locally managed tribal or nonprofit clinic. But the Affordable Care Act changes that. Once you have an insurance card from a marketplace exchange or from Medicaid, then you have a choice. You can go to any doctor, including those in the Indian health system. Jacqueline Peta is Executive Director of the National Congress of American Indians.
That's the other reason why you need to think about this as a business, because you need to be competitive and you need to be able to make sure that your services are really indeed services, that people feel that they're getting their full value. They are now being able to associate not just getting free healthcare, but they have an opportunity to go other places. And you want to be able to make sure that your tribal members feel like they're getting the best service in town. And by having the right kind of doctors, being able to make sure that their whole medical needs are being met through the facilities that you can provide.
In some ways, the urban Indian clinics are ahead of this trend. Ralph Forcara is Executive Director of the Seattle Indian Health Board.
For us, anyway, probably the greatest challenge, and that is balancing the historical manner in which we've provided services which have been geared around the needs of the population with the growing demand for reaching out to other communities to get sufficient volumes in order to be able to get the revenues necessary to keep the doors open. And that's always been a problem for the urban Indian health programs, because we've always had a combination of resources that we get from the Indian Health Service to operate our programs, and then resources that we get from others, primarily government sources, that have an obligation as a result of getting those resources that we serve anybody who walks in the door. So that balance of native to non-native people in your organization has always been a very, very complex thing to manage. Some clinics around the country have seen dramatic drop-offs in the number of Indian participants in their programs because the economics of it just don't work. They need to go out and they need to seek non-native people and enroll them in their programs in order to be able to keep the doors open.
The Affordable Care Act sets in motion huge changes, pushing Indian clinics to operate as businesses. Then that's already happening in some locations. At the Alaska Native Medical Center here in Anchorage, patients are referred to as customer owners. That conveys both a sense of ownership and a recognition that any patient could take their business across town. It's that sense of service that will be essential for all clinics in this new regime. If a facility does not meet standards, not the government standards, but the patient's, then it will not survive. For a lot of Indian Health Service or tribal clinics, the Affordable Care Act is uncharted territory. It's the territory of competition. I'm Mark Trahant reporting.